In an old concert hall, 24-year-old MAEL CAMERLYNCK is being tested for COVID, part of a mass campaign against the virus in the northern French city of Roubaix. Health workers want to test most of the 130,000 people who live and work in the city to isolate positive cases.
I feel a duty to participate as a citizen because the labs need as many tests as possible for their research.
French health authorities chose Roubaix for mass testing because its infection rate was one of the highest in the country last year. It's lower now, but as elsewhere in France, the city's doctors fear the spread of the highly infectious COVID strain that's forced the UK into a third lockdown. Jean-Philippe DANCOINE is a doctor and deputy mayor of Roubaix.
When the health ministry decided to mass test Roubaix, we didn't know about this so-called British strain. Now that we know more, we asked the health ministry to search for the UK variant in the positive cases we detect during this campaign.
So far, less than a dozen clusters of the variant have been detected in France, the biggest in the southern city of Marseille, linked to a French family who'd returned to the city for a holiday from their home in Britain. Many people in France worry that the situation in the country could soon become similar to that in the UK, where the COVID variant has been described as out of control in some areas. The French government's under pressure to do more to stop its spread.
Everyone believes that we will be in the British situation soon. The question is when. So the president of the French scientific committee said it will be in March or April. Personally, I believe that it probably be sooner, at the end of February.
The new emergencies prompted the government to order researchers to re-examine recent tests nationwide. They've also accelerated their vaccination programme.
We hope to have vaccinated more than 1 million French people by the end of January, and we also want to prioritise the vaccine for the 15 million people regarded as the most vulnerable.
The government is racing to curtail the COVID variant and avoid another national lockdown. But the message from most health experts seems to be that it may be already too late. Natacha, Butler, Jazeera, Roubaix.